Nutrition, sleep patterns, and daily activities determine the future of our health. St. Luke's takes pride in being a champion in lifestyle medicine to improve the quality of life for their patients and the community. Today we will be learning more about how we can lower our risk of illness and improve our health. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at lifestyle medicine offered at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Dr. Megan Grega, who serves as the Lifestyle Medicine Course Director for St. Luke's Family Medicine and Internal Medicine residencies. Dr. Grega also serves on the Governing Board of Directors for the American College and the American Board of Lifestyle Medicine. Dr. Grega, thanks so much for being here.
Oh, it's a pleasure. I always like coming to hang out with you, Ashley, and our wonderful colleague, John.
And we love having you here, and we have so much to get to tonight. Before we get started, can you tell us what is lifestyle medicine and why did you go into it?
What I really wanted to be was a healer. Somewhere along the line, I saw a quote from Hippocrates that was called the Doctor's Creed. And it said that doctors are supposed to cure sometimes, relieve often, but comfort always. And that really kind of resonated with me, as well as the idea of being a part of a community and really having relationships with people, helping them to live their longest and healthiest lives, especially primary care, family medicine. But over time in my career, I realized that even though I loved my patients and we had great relationships, that people were really struggling with being able to return to a state of health or well-being after being diagnosed with a chronic disease. As it turns out, a lot of people in our community are struggling with things like hypertension and diabetes. And even though we have medications and things that we can do to help people actually kind of manage those diseases, they rarely return to the same sort of level of functioning or well-being that they were before. And that's when I started looking into lifestyle medicine.
Really exciting. We can't wait to learn more. Thanks for being here, Dr. Grega. And joining us next is John Graham, an internationally recognized fitness expert and published author who serves as the Senior Network Administrator of St. Luke's Fitness and Sports Performance. John, thanks for being here.
Thanks, Ashley. It's always great to be with you.
Well, you have an extensive background. What is it that you love about lifestyle medicine, sports performance, and really helping people?
Well, I think the biggest thing is the long-term effects of what we're doing every day. Whereas a lot of times when you're dealing with acute problems that people experience in the medical world, it's a short-term fix that they're going through. But how do they take that short-term fix and then turn it into a positive lifelong experience of being healthier? So a lot of times we're working with physicians who are dealing with chronic conditions and disorders, and also our rehab professionals to help them take their patients from where they're at the completion of their treatment to now living a lifelong of health and wellness.
You both mentioned this concept that someone might be dealing with a chronic illness or have overcome surgery or something in the hospital and then continuing some sort of healthy lifestyle after that. Dr. Grega, how important is it that people incorporate physical activity and wellness into their everyday life, especially if they're battling something?
I would say that's the most important choice they can make. I mean, it's very important to have great doctors and physical therapists, but really it's what you do every day as far as the food that you choose to eat, the way you choose to move your body, how much you prioritize restorative sleep, how do you manage your stress, how do you manage your relationships, do you have a supportive social network, and what sort of substances do you choose to consume? Those are the real drivers of our long-term health and wellness, and so paying attention to those parts of your daily life are going to have one of the biggest impacts on how long and how well and how happy that you live.
You mentioned so much about the complete person, our physical and mental, emotional health. John, how important is it to have a routine in your life throughout your lifetime, if possible?
It's critical, and right now the standard or the goal that a lot of the organizations like the American College of Sports Medicine, the National Strength and Conditioning Association, and the American Council on Exercise are endorsing is that we want to exercise at least 5 days a week for 30 to 60 minutes, incorporating not only cardiovascular exercise, but also the importance of strength training. The newest philosophy is that strength training has a more significant impact on someone's longevity and lifelong health than even cardiovascular training does.
Well, it makes perfect sense, and we're going to dig in a little deeper when we return. Thanks for sharing your expertise. We'll be right back after a short break, but before we do that, let's check in with Dr. Matthew Dorcas out in the field as he discusses our health by the numbers.
Hi, my name is Matthew Dorcas. I'm a family medicine physician at William Penn Family Practice. Roles and responsibilities involve taking care of patients from any age, all the way from infants to elderly patients. We do it all here. I can do general practice stuff or general health coaching, helping people make change without medication. So that's things like sleep, substance abuse, things like that. So BMI is body mass index. This is the index of the mass of your body, so the weight of your body versus your height. Weight and BMI in general takes a role in increasing your risk factors for certain diseases down the line. Diabetes, for increased blood pressure, for increased cholesterol, possibly for joint stress or arthritis. So diet's a big one. Overeating carbs, overeating fats, and sugars. Sleep can make all of this worse. So if you don't have good sleep, your body's not resting. And if it's not resting, then it is not using these nutrients and the things that you're putting in appropriately. We say 7 to 8 hours of sleep is really where you want to be. So we talk about 3 different things: consistency, quality, and quantity. Okay, so being consistent with your sleep. That means going to sleep and waking up within the same hour every day helps your sleep. I try to meet patients where they are. We can't do everything perfect every day. We try to make small changes that are going to make big impacts. We figure out what is most important and what might make the biggest difference in their life first. So depending on what the number is that we're worried about. So if it's sugar, typically my first lever to pull is going to be nutrition. Try to make a simple change. No more soda, the highest sugar content items, no more candies, big goods. Try to remove those from the diet first. Once they're willing to do something like that, then we might start to get more intricate. Okay, good, let's start doing some exercise now. So kind of meet them where they are and start setting goals short term so that we can make more long-term goals for their life. Community is a big part of health, something we sometimes forget about. Finding that healthy community that you want to be a part of, that sometimes can help you meet those goals. Something that gives you purpose might help you find better health as well.
The team that we have put together of sport performance coaches and athletic trainers is why parents should choose St. Luke's University Health Network for their sport performance needs.
St. Luke's and our coaches are going to provide the safest and most comprehensive training environment that a student athlete would want. And I don't think there's anything in this area that can rival it.
Welcome back to St. Luke's Health Now. Tonight we're discussing lifestyle medicine and the many advances offered at St. Luke's. We want to thank our viewers for tuning into our program and for submitting their personal questions that we'll answer later in the show. Joining me are fitness and nutrition experts Dr. Megan Grega and John Graham. Let's dive deeper into lifestyle medicine at St. Luke's. Dr. Grega, tell us what the pillars of lifestyle medicine are, because you mentioned a lot of different things in your introduction, and why are those pillars so important?
One of the most important is a predominantly nutrient-dense, whole food, plant-based diet. Now, it doesn't have to be completely like vegetarian or vegan, but making sure that you're paying attention to how many ultra-processed foods do you eat, how many fruits and veggies do you get every day, whole grains, beans, nuts and seeds, those sorts of things are the types of foods that really nourish our health. So nutrition is important, but there's also a pillar of physical activity, which I know John is going to be talking about quite a bit, but is also one of the most important levers that we can pull. And then there's things like making sure that you get enough restorative sleep, that you prioritize healthy stress management strategies, that you focus on your relationships. One of the longest studies of human health and well-being and happiness found that the strength of our social connections, our relationships, are actually more important than almost anything else as far as how long we live, but also how well we live. Then there's also the avoidance of risky substances and exposures like tobacco or excessive alcohol use. So when we look at the pillars of lifestyle medicine, the reason they're so important is because they have a bigger impact than almost anything else than we can do as far as our health and our longevity. For example, there is a study and it just looked at 4 healthy lifestyle factors. Did the person smoke? Did they have a BMI less than 30, which meant that they were not in the obese range? How much physical activity did they get every week? Did they get at least 3.5 hours, which is like 30 minutes a day? And also, what sort of food were they eating? Was it predominantly whole foods like fruits and vegetables and kind of a limited red meat consumption? So again, not a vegetarian or a vegan diet, just kind of a nutrient-dense, plant-forward type of diet. for the people who could say yes to all 4 of those lifestyle factors, they had a 78% decreased risk of developing any chronic disease compared to people that did not have any of those 4. And I've got to say, as a doctor, there is not anything that we can give you that would decrease it that much.
That's really incredible.
So it's a big impact.
That's really incredible. You always hear eat the rainbow. I know my mother would never make dinner without something colorful on the table, so that was a good lesson. John, we're talking a lot about the importance of regular exercise. Why do we need to prioritize exercise, and what are some tips you have to help people make it something that they do on a regular basis?
Well, the importance behind prioritizing your exercise program is it really helps from a standpoint of increasing your metabolic rate on a daily basis, helping your body to be very efficient at burning fat and utilizing fat as energy, as well as helping you to maintain or gain lean body mass in the form of muscle. The natural tradition is that most people will lose muscle mass as they go through the aging process, and we want to try to offset that by having a workout plan or an exercise program combined with our nutrition that enables people to retain lean body mass.
It's interesting you mentioned this concept of your metabolism going faster, right? That's what happens when you regularly exercise. So it's not really just about the exercise in that moment or how many calories you burned, right? It's something that continues on even when you're sleeping?
Absolutely. So the post-metabolic effect of an exercise program could be anywhere from 7 to 24 hours. So the goal of exercising daily is the fact that it just keeps your metabolism active for long periods of time, day in and day out, as opposed to every other day of exercise where you progressively increase your metabolism, but then it decreases the next day because you're not doing any physical activity.
Wow, that's really excellent. Interesting to know. Dr. Grega, what are some things that can sabotage our progress or set us back, even with our best efforts, in living a healthy lifestyle?
I often say that lifestyle habits are contagious. So you are more likely to do the things that the people around you are doing. So for example, a supportive group, maybe friends or family who like to go for a walk after work to kind of relax and unwind, or they like to do the physical activity sorts of things, you'd be more likely to do that as well. So we have to think about, when we look at our social networks and the people around us, who are our allies, and who would we say are our accomplices, the people who might entice us to kind of go backwards on some of our goals that we're talking about. And then really try to spend as much time with your allies as possible, because those social norms are going to help you make the changes that you want to make. And with your accomplices, just be honest with them and say, hey, I love hanging out with you, but this is something that I am really trying to work on. Can you help me out so that we're able to do some things together, but that continue to do the things that I'm trying to do for my own health?
You are the company you keep, right, Dr. Grega? That's great. John, so many people struggle with how to get started. So maybe it's a nice day and they know to go for a walk with a friend or a neighbor. But how do they start an actual fitness program that especially includes weight training, where they might be concerned about the proper way to do that?
We have 5 medically based fitness centers throughout the network. And what the difference between a medically based fitness center offers maybe than a traditional commercial facility is that integration of health and wellness and an evaluation of your overall health and wellness through an assessment process that includes not only a questionnaire to evaluate your chronic conditions and disorders as well as injuries from your past, but also your current level of health and fitness. And then an ongoing measurement of that to ensure that you're improving, or that there is some kind of documentation to show you, hey, I've made some improvements over this period of time.
Always nice to know you've improved, but also to have that accountability showing up with guidance along the way is a good way to go. Dr. Grega, we certainly have an epidemic with chronic health problems. What do you think needs to be done in someone's everyday life to take those baby steps to get started to reverse those patterns? Because sometimes it can feel really overwhelming.
I agree, and unfortunately that is correct. We are definitely in an epidemic of chronic disease in this country that has changed dramatically over the last 30 years that I've been in medicine. Back in 1958, only 1% of our population was diagnosed with diabetes, and now it's at 13% across the country. How do we make these changes? And I would say the first thing is to figure out your why. Why is it important for you to be healthy? Not just for a negative reason, like I don't want to take more medications or something like that, but more like what brings you joy and what is it that you want to be able to continue to do for the years to come. So once you start to think more about what matters to you as opposed to what's the matter with you, you can really get that as a motivator to decide to make these changes. And then once you know what your why is, start to make small goals. We call them SMART goals, and SMART is an acronym that means specific, measurable, achievable, relevant, and time-bound, so that you're not just saying, oh, I'm going to exercise more, or oh, I'm going to eat better, but you have a very specific goal in mind. That's how you can get started on small steps then make some good wins and then adapt your goals as you move forward.
What a great way to think about goals and exercise. And John, as people do that, can physical activity and exercise really make those reductions in chronic disease and illnesses that people are suffering from just over time?
If you talk to anybody who's been exercising regularly and they go to their physician, the biggest thing they're going to see is that change in their cholesterol, which is changing that ratio in a positive direction. They're also going to see changes in their weight level. So those things are really beneficial when it comes to being able to make positive changes. And when you look at 60% of the population has at least one chronic condition or disorder right now, and 40% have two or more, it's just really becoming even more critical that people have that role reversal when it comes to chronic conditions and disorders.
It's easy to say it, but it's harder to do it. So Dr. Grega, do you have advice on helping people commit to the changes that we're talking about?
One of the key things is to set your environment up for success. For physical activity, you're saying, okay, I want to do some more physical activity. Well, then make it as easy as possible. Have your sneakers by the door when you get home, or have your physical activity exercise clothes in your car. But then also see if you can get an accountability buddy, because accountability is the key. And even if that person isn't doing the same changes with you, tell them what your plan is and ask them to check in on you and see how things are going. And that's a really good way to get started.
That's always been helpful to me. John, you've published a new book on metabolic conditioning. Can you tell us about the book, and how is metabolic conditioning different than other exercise, and is it for everybody?
The idea behind the book, when Human Kinetics came to us, is they said, how do we write a book that really can encompass all populations, from people who want to lose weight to people who want to gain muscle to people that want to get better at sports? How do we make those changes for people, and how do we put programs together in such a way that we can do that? We have 60 different workouts in there, 12 for each different area of expertise we're looking at helping people with. Everybody can do it together. It doesn't have to be separated based on fitness level, because the people that are really fit, or the more fit people in the group, will do it for longer periods of time during a minute section, and they'll also use a heavier resistance. So by setting different weights at each station, we enable the people who are at the lower levels of fitness to be able to use a lighter weight for less time, and the people at higher levels of fitness to use a heavier weight for longer periods of time. It allows everybody to work out together. And going back to Dr. Greger's point about relationships and having people with you, what we find is our metabolic classes are the most well-attended classes because everybody gets to do it together and they enjoy it together, and nobody feels intimidated or out of place with doing it.
I love that, a really inclusive environment. It's really incredible how much knowledge and help is available to people out there in our community. Speaking of, we have some questions sent in from our audience. We'll get to those right after this short break. Stay tuned.
When you have an emotional imbalance or a mental ailment, it does affect you in a way that you begin to withdraw from everything because you don't think you deserve to have any joy in your life. There are a lot of different things that people can do to you. There had not been a day in my life that I had not felt the things that my dad told me to feel. You're stupid. You know what? You're as dumb as a bag of rocks. You're never going to be able to do anything in life. The mental pain. It wasn't until a year and a half ago that I actually saw hope.
So Chuck is a wonderful individual, and he actually works for our IT department, and just so happened I needed his help. What was supposed to be literally a 10-minute project ended up being an hour conversation.
I was able to come in and I resolved the issue for her, and she looked at me and she said, "Are you okay?" And I said, "No, I'm not." She said, "You want to talk about it?" I said, "Please."
The more we kind of talked about it, he started to share more and more intimate details of his life, and just, I don't know why, I don't know what happened, and I was like, would you want to do therapy specifically with me? And he answered yes, and kind of the rest is history.
That was the pivotal moment. It was the beginning of the most phenomenal journey I have ever been on in my life.
The mind, if we experience a lot of psychosocial stressors, people then start to engaging in self-sabotage behaviors. A lot of those issues, whether it is GI issues, eating issues, sleeping issues, they are all could be stemming from depression and anxiety. So I think one of the most important thing to discuss is the mind-body connection. In many ways, he had a lot of negative thoughts about himself, thinking he is not worthy, he's inadequate, and he was able to challenge it a lot through the CBT techniques, such as cognitive restructuring techniques.
Imagine a bird in a cage with a shroud. That was my life, completely and totally. I was in the dark. Every time we would work through something, every time we'd talk about a cognitive distortion, she showed me there's a totally different person than what's in that cage. And then one day, the shroud started coming off. And I could see light. And the light gave me hope to continue. When that shroud was finally completely removed, all I had to do was fly out. You want to know what I did? I flew out and I soared. I soared like I never soared before. It was so life-changing. It truly was.
So one of the things that I really pride myself in being an employee of the St. Luke's Penn Foundation Mental Health Services is that we really have a lot of access points to receive mental health services.
They talk the talk and they walk the walk, and you won't be disappointed. It is amazing what even a smidge of compassion can do to make people feel so much better. Here at St. Luke's, we have the ability to care for both a physical ailment and a mental ailment. There is no stigma associated with mental illness.
Kids have enough to worry about, like tea parties, problem solving, and, well, growing up. So let us worry about their health. St. Luke's Pediatrics.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo, and we've had an engaging conversation about lifestyle medicine at St. Luke's University Health Network, thanks to our amazing panelists. All right, now it's time to take some questions from the members of our audience. Are you both ready?
Absolutely.
Excellent. All right, John, I think this one is for you. I am 32, and with work and home responsibilities, I really haven't worked out since college. I'd like to get back into a fitness program, but I'm not sure where to start. Can you offer some advice? That's a great question.
Do it by assessing where you're currently at and any limitations that you might have. So our St. Luke's Health and Fitness Centers, or what we call our Fitness and Sports Performance Centers, are really designed around the concept of helping everybody at all different levels of fitness to re-energize their program or take their program to the next level.
And I think that's key, all levels of fitness, because often if we've stepped away from a healthy lifestyle for a while, there's sort of guilt and shame and fear around getting back into it. What do you say to people about taking that first step?
What I tell people the most important thing is to really engage in getting involved in activity again. St. Luke's is really honored to be a part of the Get Your Tail on the Trail program. We have 165 miles of trails in the Lehigh Valley that people can get out on, exercise on a daily basis. Go out with your spouse, your significant other, your family, your dog, and take a nice walk on one of our trails. That gets you really re-energized. Once the weather gets warmer, we just feel better.
I love that. That's a great idea as a first step. All right, Dr. Grega, this question is for you. My family loves to have some type of meat as part of the meal, but I'm considering trying a plant-based diet. How do I make changes at the dinner table without upsetting my family? This is a great question.
That is such a common question. So I'm really glad that it came up, because there are ways to be able to shift without, driving your family absolutely crazy. First of all, there's a lot of things that are delicious and plant-based that you don't even realize that there's not necessarily like meat at the center of the plate. For example, chili. So we often do the Kelland 3-bean sweet potato chili that we give out as recipes for our patients so that they can try that. And if your family is saying, hey, I'm missing the meat in the chili, then you can sort of divide it up, put some meat in half of it, have half of it that is not. That's one option. Another great one is things like tacos or burritos, where you can make all the different parts of the meal, but then some people make their own with the meat. You make your own without the meat. Make sure there's a bunch of beans around. So it's very important that, first of all, don't create stress in your family. That is not going to be helpful in the long run. Just look for things that they're going to enjoy anyway. So one step at a time, don't stress out too much, and there's a lot of delicious things that are out there that your family will like regardless of whether there's meat or not.
What about substituting in something like fish or ground turkey or something that's more of a lean meat?
That is an option, because definitely things like red meat, especially processed red meat, that's one of the ones that we know has the biggest link to things like heart disease and colon cancer and things like that. Fish can be great, but the problem is depending on what sort of water it's swimming in, it can have things like persistent organic pollutants in it, so you don't want to necessarily eat it every day all the time. Now, things like turkey and chicken, that's going to have less saturated fat most likely than the ground beef. However, you still have the potential issues of the fact that depending on how they're grown, whether there's any antibiotics or growth hormones that are in them. And just move yourself down the path towards eating as many whole plant foods as possible and see what works best for your family.
And there are lots of great sort of seasoning and herbs and flavors out there that can change the taste of something very quickly.
I agree.
And add to vegetables.
Yeah,
if
I
you're
agree.
creative.
Because actually, when you think about it, if you have a piece of chicken or a piece of meat or a piece of turkey, what do you really taste? Usually it's the flavorings, it's the herbs and spices, it's the sauces, it's whatever you cooked it in. It's not necessarily the flavor of the meat itself. So experiment. Try that on tofu, try that on beans, try it on a lot of different other things and see what is it that you love as far as taste, and just experiment with some of the other options.
Good advice. All right, John, this is for you. I am not a gym person, but I do walk a few miles most mornings. Is this enough, or am I missing something in my fitness routine? I think a lot of people have that question.
The most important thing that person would be missing out is the strength training component. So getting strength training at least 2 to 3 days a week for 30 minutes at a session would be very valuable to them. At St. Luke's, we've made virtual workouts now that we can actually send to people who have that interest and want to do it at home or want to participate. A set of dumbbells could be instrumental in doing that, or even filling 2-gallon jugs up with water could be an easy way to go through a strength training program. But you do want to incorporate that in, because the natural process of aging is we're losing muscle mass as we're going through the aging process, and it starts very early in the early part of our adult years. And as we continue to progress, we lose that muscle mass. That really decreases our metabolism, slows our metabolism down, makes us more vulnerable for a lot of the chronic conditions and disorders we've been discussing today.
All right, I like that. Fill those water jugs up. Dr. Grega, this is for you. Buying healthy food for a family of 4 is pretty expensive, especially if it's organic. What advice can you give about shopping better on a budget, and what should we look for on food labels?
This is one of those things that comes up a lot. What about the cost of eating healthy? And I would say it depends on what you choose to fill. You mentioned the rainbow of colors earlier. What you choose to fill your plate as far as the healthy food. So yes, if we say organic berries out of season, that's going to be really, really expensive. Versus if you get the frozen big pack of mixed berries in the freezer section, that's going to be a lot less expensive and is still going to be just as healthy for you. So there's a lot of foods that are very healthy for you and are not expensive at all. Beans are a great example, sweet potatoes, onions, apples, tons of different things. If you're cooking with your green leafy vegetables, you can go to the frozen section and get a big box of frozen spinach for probably about $1. There's a lot of frozen vegetables that are just as healthy as the ones that we can get fresh and much, much less expensive. And there's just a ton of things that you can batch cook with that are actually pretty inexpensive. So for example, things like sweet potatoes, onions, apples. There's a lot, brown rice is another great example if you get it in bulk. So there's a lot of things that you can choose to use that are still going to be really healthy and are actually going to be less expensive than some of the meat options or dairy options that you might have on your shopping list already.
Excellent. That's great advice. And I think that if you buy in bulk and you batch cook, you're cooking at home, it's healthier, it costs less, win-win all the way around. Thank you so much for joining us. Really, both of you, excellent information. For more information on lifestyle medicine and the services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. Thank you for tuning in to this special episode. We hope tonight's program leaves you feeling informed, inspired, but most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.